I'm Don Paulo. Today, I want to share 5 ways hyperbaric oxygen can improve the global performance of the body. First, hyperbaric oxygen is a very safe, whole-body treatment that treats the body from the inside out. When we need to heal and recover, there is an increased metabolic and energy demand. This is why we need to rest, sleep, and increase our nutritional intake to optimize our healing factors. All major functions of the immune system requires oxygen to perform the best. When we breathe pure oxygen in a hyperbaric environment, we increase our mitochondrial function by improving and increasing its ability to create ATP, or energy. Inflammation is seen as the underlying cause and root of many acute and chronic illnesses. And that's actually the lack of circulation and the lack of oxygen that propagates this really destructive inflammatory cycle. In a hyperbaric environment, we increase and we can actually quench the inflammatory thirst by increasing the O2 concentration by up to 800% in the body. It is now well established that even one session of hyperbaric can dramatically increase our stem cell distribution. Secondly, hyperbaric oxygen is a wound healing marvel. Multiple studies have shown its effectiveness in both simple and complex wounds. Not to mention, there's an increased use of it in cosmetic surgery due to its improvement in appearance and effectiveness. Wounds can be formed either through acute trauma or through chronic conditions such as diabetes and polio. When microcirculation gets deteriorated, there is a decrease in oxygen supply and the removal of waste. So how quickly we can get the oxygen and the microcirculation back can determine the rate of wound healing. High doses of oxygen under pressure not only increases the rate of wound healing, it can help to prevent infection and helps to minimize the appearance of scar tissue. When you combine conventional therapy with hyperbaric oxygen and an improved nutritional profile, there is a cascade of healing factors that goes on in the body. Firstly, with the increased environmental pressure and pure oxygen, we can get through blockages with an increase in diffusion distance. Now, when this happens, we're able to decrease the rates of infection because of the vasoconstrictive effect and the removal of waste through the lymphatic system with that vasoconstriction. And lastly, and the most importantly, hyperbaric oxygen is known to increase the rate of angiogenesis, and that is the creation of new blood vessels. Thirdly, hyperbaric oxygen can potentially improve and optimize brain function. Multiple studies have been done internationally that promote its use for concussions, strokes, traumatic brain injuries, and even the prevention of Alzheimer's and dementia. These conditions lead to altered brain metabolism, either through an inflammatory aspect or altered circulation to the area itself. Now, a wound in the foot and a wound in the brain both require an increased demand of oxygen to the site to promote healing. We know hyperbaric oxygen can not only promote neural stem cells, but it also increases the metabolism in the area with the creation of new blood vessels. Interestingly, studies have also shown its ability to improve mental functioning, such as cognitive tasks, multitasking, and executive functioning in the chamber itself. And this is one of the main reasons why I really enjoy doing this therapy for myself, because very scientifically, it makes my brain feel good. And this is also why we see a lot of professional athletes, especially football players, who are getting repeated trauma to the head using this treatment right after their games to optimize their health, prolong their career, and prevent further injury. Fourthly, hyperbaric oxygen helps with bone density and bone healing. Physiologically, if we look at the bone, it is the supporting and stabilizing structure within the body. It's what our muscles and tendons attach to, and it's in our best interest to have them as strong as possible to be able to generate a lot of force effectively and safely, repetitively over time. Now, bones are notoriously known for being slow healing because being so dense, it only has a limited blood supply. Very cool though, they've done studies where in the presence of a fracture, when you introduce hyperbaric oxygen environment, you can actually influence the fibroblast activity within the bone. Now, the fibroblasts we're most interested in is osteoclast and osteoblast activity. These determine the amount of calcium and collagen uptake into the bone matrix. So in the presence of hyperbaric oxygen, these fibroblasts are induced to create an anabolic state of bone formation. It reduces inflammation and will actually lead to a more denser bone structure while leading to new bone formation. Now, here in North America, it's actually approved for stage 4 osteoradionecrosis. Basically, when you get radiation following sort of cancer therapy, a lot of those small blood vessels, they tend to die and erode over time. And what we get is that usually in the hip or in the jaw, you can actually get a demineralization of them, and that just leads to very, very serious complications. So we know that this prevents further bone loss. But, stage 4, there's 3 numbers before that, so it only makes sense that preventatively it would also do that as well. Lastly, hyperbaric oxygen is very helpful for inflammatory bowel diseases such as Crohn's and colitis. The causes might be different, but the net result is an impaired bowel function which can wreak havoc on the body. There is a growing scientific literature and evidence that shows that the connection between our gut and our brain is really, really intertwined. There is a very deep connection between our immune system, our internal flora, and our nervous system. So we really want to take care of these 3 pathways to improve our health overall. Now, prolonged cases of Crohn's and colitis leads to really nasty side effects. We can get bloody stools, diarrhea, it can lead to infection, and over time, if it gets really complicated and untreated, it can lead to surgical interventions such as colostomies. Now, there aren't too many options that are offered to people beyond long-term corticosteroid use, but the long-term sort of efficacy using them isn't necessarily favorable because of the side effects of prolonged use. There are, however, multiple cases and studies where when you combine sort of conventional therapy with hyperbaric, you can get full refraction and healing of the intestinal flora. So this will lead to improved mobility, motility, and an increase in stem cell production in the intestines, which leads to a full healing of the intestinal tissues, which is very, very promising. Let me know what you think below regarding any of these issues. If there is something you want me to address or focus on in upcoming videos over the next little while, like, comment, subscribe, let the community know what you think, and if any of these could potentially apply to you. Knowledge is power, and the more that we know, the more we can protect ourselves and help our community. That's what it's all about. So I look forward to seeing you later, and we'll talk soon.